Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the August 7th media availability. Thank you for being here with us.
Thank you.
Would you like to start by addressing the community?
I just wanted to point out, people will probably recognize I'm not wearing a mask, and I think that's a first since we began the masking order. I'm not wearing a mask today because we have received multiple suggestions from people that I not wear one because they're having difficulty hearing or understanding me, and we want to make sure the information is accessible to everyone. We are also moved location for this so that the folks interviewing can be distanced and masked, and so we're going to try this approach and see if that helps.
Thank you.
Thank you.
The Time Standard asks, when does Humboldt County project the next peak in cases to occur? With nearly 50 new cases in the first 4 reporting days of this month, how close is the county to elevating the risk level to 4?
So the new case count is concerning, and our positivity rate is definitely increasing. We have not hit a threshold to move us to 4, and so it really will require for us to move to 4 that we have multiple indicators in one of these segments that are of concern. So when we're looking at our contact tracing, when we're looking at our testing and epidemiologic data, and when we're looking at our healthcare system. So we're not there yet, and no single indicator, no single measure is likely to place us there, but it's going to be a constellation of how we're looking across the board. So I don't know. I'm hoping that we can avoid it.
Thank you. The Time Standard asks, with more than 40% of cases in Humboldt County affecting those who are younger than 29 years of age, how is it considered safe to allow schools to meet in person? It strikes many as odd that school district boards meet via Zoom over safety concerns, but are okay sending hundreds of students back to in-person teaching.
Well, and I understand, and I've gotten the question many times about gatherings and how we don't want people to gather, and yet we're pulling people together in school settings. I think the distinction here is, again, that when, for instance, we're talking about school boards meeting via Zoom, it's because functionally it works pretty much as well as it does meeting in person. I think the difference in the school setting is that I think we all agree that virtual teaching is important if we can't have on-site instruction, but I don't think anyone argue that it's interchangeable with on-site instruction. I think for most children, they do better in a school setting, educationally, developmentally, and on all those fronts. And I think that it really is the idea that with no completely safe option moving forward, how do we balance risk and benefit within the community? I think there's less benefit to us having social gatherings, less benefit to us having business meetings in person, and there's greater benefit to having children in school wherever that is possible to do under good safety guidelines.
Thank you. The Redwood News asks, looking at the county dashboard as of this morning, there are currently 32 cases under investigation. This number has seen more growth than other transmission types this week. Can you talk about why there is such a large number under investigation? What issues or roadblocks are you seeing during your contact tracing investigations makes it more difficult to determine the form of transmission?
Well, I would just say that from a practical standpoint, when we're doing contact investigations, the more cases that you get in a short period of time, you have multiple case lines that are being followed, and sometimes it takes a little bit to find out how this new case intersects with a previous case. So we don't want to prematurely assign it to one category or another until we can pretty clearly establish that this new case has no relationship to any of these other cases that have just come in the door. Once we're able to do that, then we assign it to a category.
Thank you. The Redwood News asks, you've talked about HUPA's recent cases and how they are included in our county data, but not necessarily the same day HUPA received the results. You receive copies of the results, then vet them. Can you talk about what this vetting process looks like? How much of a delay is there between the day HOOPA gets the positive test result and the day that it is counted and added to Humboldt County's data?
So it's really just a process issue. At the beginning of this, and I'm pausing because it's sort of how far in the weeds do we get with this, but with the particular equipment that HOOPA is using, it's a point of care test that we use in many outpatient type of settings. It has its limitations. And so with these instruments, we've actually asked labs to send us their initial positives and negatives so that we can retest them with our higher level equipment and verify that they are positive or negative. And so especially at the outset with HOOPA, we were receiving those specimens. So they had, for instance, positive on site. We needed to receive those specimens, rerun them in our lab before we confirmed them as positives or negatives. Going forward, we don't have to continually do that. But there are instances where we may feel it's important that we repeat the test before we confirm it for various reasons in a case investigation. And so there again can be lags between when HOOPA may report their finding and it goes into our official statistics. And that's just important so that we keep those numbers on our county reporting and that we're reporting out to the state. We keep them as accurate as possible.
Thank you. The Redwood News asks, can you confirm Humboldt County has not received any additional funding to hire contact tracers? So how are you staffing that team? How has it grown since the beginning of the pandemic? Do you need more people? Is this hindering contact tracing investigations?
So I think with our contact investigations, just like testing, it's a continuous work in progress. When we began this pandemic response, we trained some people initially. We pulled people in from multiple departments and areas. Because of the length of this pandemic, some people have had to move back to the places that they were working, and we've had to bring on new people and train them and get them up to speed as well. So we're sort of constantly refashioning our teams. And right now, I would say that there is funding coming into the county to help support pandemic response. And so we work with that. We also have, again, been maximizing everyone that we can use internally, that we can free up their capacity to be part of the response that makes sense to use. So for instance, our nursing staff, using as many of our nursing staff as possible to lead investigations. Contact tracers are sort of the first rung in doing these contact investigations, doing a lot of the calling and follow-up that we need done. Those folks we've been gradually bringing on. We're using volunteers. We're using paid employees to be able to do that work. And we may actually pull people in more broadly in hiring. But again, because of just expediency, it's easier for us if we're able to harness as many people as we can internally rather than starting to recruit and interview and bring additional folks on outside that. But I think going forward, we'll be doing some of that because we're clearly seeing that some of these cases are complicated. There's multiple contacts, and we really need to have lots of boots on the ground doing the work. And again, we're staffing this generally 12-hour days, 7 days a week. And so we do need a fair amount of staff to do it.
Thank you. Mm-hmm. The North Coast News asks, the Sonoma County Board of Supervisors approved an ordinance that allows the issuing of citations for businesses not complying with health orders related to coronavirus. Citations will range from $100 for people and up to $10,000 for businesses who do not follow local and state health orders, they said. Is this something that could happen in Humboldt? Who can make that decision? And who would be tasked with enforcement?
So enforcement is really a key piece of this response. Our perspective has been to make it heavily educational. In our perspective, we feel like businesses have suffered a lot in this pandemic, and they are important to the families who live and work in this community. And so we are trying to support them, and we do feel that most businesses, when we approach them, are interested in complying, and that's helpful. we all recognize there are some businesses that are going to be outliers on that. And so we have been building a codified response to that in terms of a process of verbal education and then verbal warnings, as well as then written warnings and proceeding through. Citations can certainly be a piece of that as needed, but our hope again still remains that most businesses with engagement will actually be able to change their practices and operate more safely.
The North Coast News asks, there is a lot of talk about mass voting by mail. Do you think mail-in voting is the safer option for the public rather than gathering at the polls?
Well, first of all, I'd like to say it's incredibly important that people vote, and I strongly encourage everyone to do so this year. In terms of voting, I think certainly you can contact the elections department for what they're currently suggesting or recommending at this time. I think that if polls are able to be constructed in a safe manner, that may be an option. I think that if obviously they have to be constructed so that there really is not gathering, in the sense that there would have to be distancing and there would have to be masking and there would need to be other safety measures put in place for the environment. If that's not available to a community, then I think mail-in is the safer option, and I think we need to have that ability to use mail-in for this election as needed.
The North Coast News asks, what do you think about the possibility of Oregon closing the border and restricting travel to and from California and Oregon to limit spread?
Well, as we've talked about many times along the way, because of our geography, it's a tempting idea to be able to sort of isolate ourselves like an island from people exiting or entering our area. Practically speaking, I don't see it happening for multiple reasons, but I think what we do have is the ability to encourage local residents not to be traveling, even though those highways are open, because it's safer to stay close to home. And I think the messaging to the broader community across the state and other states on this issue is important. There really isn't any place in this country that should be encouraging travel. And I think the message about people staying close to home at this time is incredibly important. Again, we are seeing this consistently in our cases, that travel is a frequent feature. And there's no need for us to import cases into our area from residents traveling outside the area.
Thank you, and thank you for your time today.
Thank you.